thanks to the Grin team for allowing me to use their platform and their audience to express or show my treatment and just my ideas and how I'm using Grin. One of the things that I think is important about the webinar tonight is this is my experience with it. I am sharing. I'm not saying that the way I'm using Grin is the way to do it, the only way to do it, or the best way to do it. Is just what I'm doing, and I'm sharing my experience. And if you pick up anything from it, that's great. If not, I understand that as well. Also, this is super casual. We are holding the questions to the end, and I hope that you write these questions out or type them in the chat, because I think when we have these conversations and the questions, that's how we all really learn together, and that's how we really get the information that we need. So please ask as many questions as you want, because I think that'll make the presentation that much better. In terms of the outline and the agenda for tonight, I'll do a quick intro about Grin. I know we have a good range of people on the call tonight, some who maybe not so familiar with what Grin is, and a lot of attendees who are very familiar, and some who are using it. And so to be inclusive, I'll do a quick just run through about Grin, and then we'll go into appointments on demand, which is by far the number one reason why I jumped into the remote monitoring world. It to me provided the best value for it. And once I started using it for that reason, I started seeing some of these off-shot solutions or benefits that I didn't think about at the beginning. And we'll kind of go over that as well. And that's the patient education and the patient management, and then as well as using it to train the team as well. And so again, the biggest thing is the appointments on demand for me, and I'll explain what I mean by that. And then we'll kind of go over the other advantageous benefits that Grin allows me in my office. All right, so again, a quick rundown. It's three main components. The Grin scope, which is what the physical piece of equipment that the patients will get, and it's how it allows us to receive the scans, because obviously they will hook it up to their phone, wrap their lips around it, and send in the scans of their teeth so that we can analyze and do whatever it is that we need to do with it. Then there's also the doctor portal, which is how we organize and just receive the information from our patients. This is how we communicate with our patients, and it's just a dashboard so that we can keep a handle on everything and really utilize the power that remote monitoring can provide for us. And then lastly, there's the patient app that they use, and it's their screen, and basically it's a way for them to just keep a history of their scans so they can see the change as they move through treatment. But then it's also, which I think is very beneficial, and the value that the patients see when I offer this in my office, is the ability to have a direct line communication with the doctor, and to be able to text or send a video or a picture whenever they want and know it's getting directly to me is something powerful for them. So this is the basic components from the hardware and the software side of things, that really just gives a good rundown of what Grin is. Okay, so we'll jump right into the appointments on demand, and basically, these main bullet points are the reasons why I think it is so powerful, and it's something that can really help your practice. And I know for me, this is exactly what I started seeing when I started using Grin. And basically, it's just to get more out of each appointment. I mean, no matter what modality you're using, whether it's fixed appliances, clear aligners, or maybe retention or appliances or whatever it is, we always have those situations where we I don't want to call them wasted appointments, but appointments that weren't very fruitful. And those are the appointments that clog up the schedule. And those appointments that are just not needed. So we talked about getting the most out of each appointment. The other part is optimizing the timing of each appointment. I'll hold off on going into detail, because I'll explain that in a couple of slides coming up. But then also freeing up clinic chair time and increasing the fee per visit. So there are a lot of KPIs and a lot of metrics that we use in our office to determine kind of where we are in terms of the health of our practice financially. And one of the biggest KPIs for me is the cost per visit, because what that does, it takes away a lot of the outliers in the system in terms of the case fee, appliance fee, and all these other things. And it goes down to, okay, how many times did you see the patient? How much did you collect from the patient? And divide that up and figure out what was the value per appointment. So it's not the only metric that I use or go by, but it's one of the most important ones. And to use remote monitoring really increases that, because again, if you look at the first 2 bullet points, it gets rid of a lot of unnecessary appointments that we routinely see in our office. And then last, it's more convenient for the patients. And a lot of what we do, we think about it from our standpoint and our team standpoint, as we should, because it's our business and this is our livelihood. But we also need to think about, what sort of experience are we providing for our patients, and is it creating value for them? And the answer is yes. And when I bring this option up, and it's not that they don't want to see us, and I'm not on the bandwagon of, hey, no one wants to go see the orthodontist or that type of thing. But I am on the bandwagon, or on the belief that, if they can minimize that, they would. And, everyone has a lot of things going on. And so to limit the amount of times that they have to come and see us, so not eliminate them seeing us altogether, but to eliminate the time that they have to physically come to the office, is something that they really appreciate, and something that they value. And this is what appointments on demand kind of brings to the table. So I've shown this case before on a couple of formats, but this is kind of the super sweet spot of remote monitoring. And I'm going to show this case, and I'm going to show a couple of cases, and it's not to highlight the case per se or the modality of the case, but more so how I'm incorporating Grin to really maximize the efficiency of the case. And so for Riley, not a tough case at all. One of those quick, 6 to 10 month cases that comes in, just some mild upper crowding, lower moderate crowding. He did have ortho treatment before in the past. And this is his composite. Again, up top, just some mild shifting, some mild crowding, and lower a little bit more. And that's the reason he came in, is because he was starting a new job, but he was going to be more talking to clients, and he wanted to feel good about his smile and his teeth. And this is what brought him in. He wanted to gain that confidence and get everything lined up. And so this is his first scan, and I, usually do the first scan in the office. One, to make sure that the patients know how to do it. Two, I use it as a baseline for everything. So you'll see there's certain times we need to refer back in the case, and to be able to have that first scan is huge, because this is where everything started, and this is what the benchmark of showing everything else for the rest of the case. And so usually the first scans are not not the best scans, because they're getting used to it, and as they do more of it, it becomes super easy for them to do. But that was his first scan, and after they leave the office, it's just a matter of us just becoming cheerleaders and just keeping them encouraged throughout the treatment. So, you're making this look easy. Keep it up. I just look back at your initial scan. So hint, hint, what I talked about, having that first scan so they can see how things were before we start moving things around. And your lower front teeth have come a long way. And he's very respectful. Thank you, sir. And he had some other things to say. But then also he sent some more scans in. I told him, you're killing it. And then I had, which number of aligner you're on. Now, I will say this was back with one of the first iterations of Grin, where there were two things that, for whatever reason, whenever I told the patients, they never did it. And it's for the clear aligner patients, I say, hey, listen, can you send me 2 scans, one with the aligners in and one with the aligners out? And they almost never did it. And for me, what I like to do is I like to see the scans with the aligners in, so I can evaluate the fit and see how the tracking is going. But then I also want to see the actual teeth to see what sort of improvement we're getting. And so routinely I would get the scans with the aligners in, and I would say, oh, that looks great. Your aligners are fitting perfectly. Can you send me one with the aligners out? Or I would get a scan with the aligners out, and I would say, great, can you send me one with the aligners in? And it was kind of this back and forth. And no matter how many times I told them, they just never did it. The other thing is I would constantly have to ask them, which aligner are you on? Because my scan schedule does not line up to their switch schedule. So typically I'm doing every 10 days, and every now and then I'll do 7 days, but I'll typically do for aligners every 14 days for the notifications for the scan. So it's not a one-to-one matchup. And so I don't know which aligner they're on when they send it in. So I was routinely asking them, hey, which aligner is this? And then again, it was adding extra time on my schedule that, I didn't feel like I needed to deal with. Well, Grin made some updates that really made me happy. And the first one is they started allowing the patients to put what aligner number they were on. So I didn't have to ask them, what aligner is this? I have this information at my fingertips already. Another thing they put in was the dual scan. So they'll send one with the aligner out. They also added this picture gallery. So what I would usually do is very seldomly do I just hit play and watch the scan go all the way through. I would hit play and grab the little ball and kind of go back and forth to look at what I need to look at. But having this picture gallery, I know it's kind of blurry on this screenshot, will just show you the upper, lower, and the buccal shots that you can just click on without having to actually view the full scan. And then lastly, the scan with the aligners out. With the aligners in. So this is one of the improvements, like I said, that made me super happy because it eliminated a ton of back and forth messaging that just didn't need to happen. And then it also, I can just have so much information at my fingertips without having to respond or say anything to the patients because it's just already provided for me. So this is how he showed up for the refinement scan. Not bad. That lower right too could use a little bit better alignment. Sorry about that picture, it's a little off there. And so we decided to go back in for a quick refinement to tidy things up. And again, I go back into my coaching persona. Oh, I'm loving the spaces that I'm starting to see form in those lower front teeth. And then here we go again with, do you have a scan with the aligners in? And just this is what it is. So instead of patients coming in for me to look at them and shoot the breeze and talk about a few things and look at the teeth and tell them, hey, you're doing a great job, keep it up, and I don't want to say wasting chair time, but using up chair time to do this, to be able to do this through this app is so much more efficient because one, I don't have a ton of back and forth. And we all know the difference in communicating through text versus verbally. A lot of times things just kind of linger on longer than they need to, and certain things come up that it's just holding you hostage at the chair. And so to be able to send these very succinct messages and keep them motivated is something that's powerful. And so these are the last two scans that he sent me, and this highlights another part of the process when, especially for me, the way I do things in my office for aligners. We rarely schedule them for a debond. We always set them up for a scan. And so when they come in, the note says, debond if happy, refinement scan is if not. Braces patients is different because I always have that appointment where I look at everything, it looks good, we set them up for the debond, they come in, we take them off. Before aligners, you don't know how the final tooth positions will be. And so to be able to see the scans before they come in, it gives me the information that I need. And so there's sometimes I look and they're at the last aligner and I know we need more work. Well, when they come into the office, I go ahead and tell the team members, go ahead and grab the scan, go ahead and update the pictures, and then I'll come over and take a look. Whereas before I would have to come over, take a look, talk to the patient, tell them, okay, go ahead and update the scan and the pictures because I need to evaluate if the patient is ready or not. And on the flip side, if I see everything is coming together nicely, I know ahead of time, okay, this patient's going to be ready to go. Go ahead and get everything set up for the debond. So again, just allow me to really maximize the time that we have with the patients when they come into the clinic. So this is where he finished. Again, not a very difficult treatment, but this is what he needed, what he wanted. We were able to give him some lower straight front teeth that he was asking for. And he was super happy. And this is, the big thing about everything. And I've like I said, I've shown this before. Basically, it was a total of 6 months of treatment. I can't remember the number of aligners we gave him, but we saw him for 5 visits, and that's including the exam and to take the attachments off. And so, if you think about that, that's really only 3 visits of treatment that we saw him in terms of aligners and checking the fit and whatnot. And this is when we talk about that fee per visit and where it comes in. And so this is just another prime example of how to use remote monitoring to only see your patients when you have to. So we did the exam. He got started the same day. So we took the scan the same day. He came in for 2 weeks later for the delivery. We did a little IPR and handed him the aligners, and then the rest of the aligners we just had at the front. So through Grin, I would see that he would get down to aligner 5. We would go ahead and put the next set, because we do in-house aligners in my office. So I go ahead and tell my lab tech, hey, go ahead and get the next set into production. And then I communicate to him, hey, your next set is ready at the front desk. So we don't need to see him. He can come by whenever he wants. There's no appointment that needs to be made. He picks them up. I'm monitoring them when he sends the scans in. And again, just very efficient treatment to get him in and out of treatment. And again, he appreciated that as well, because, no one wants to stay in the office or be at your office for a long time, but they also don't want to drive across town or spend time out of their busy schedule to come in and only see you for 2 minutes. And so it's kind of one of those slippery slope type of things where, they want to feel like their appointments are valuable. And for me, when I come over and say, hey, listen, your aligners are fitting great, here's your next set, see ya. It's like, okay, I came all the way over here for that. And so to eliminate those appointments, like I said, is beneficial for both us in the office, but then also beneficial for the patients. All right, so the next example of the appointments on demand is Lisa here. So typical adult patient, again, not a ton of, dental needs. She has some crowding and the crossbite of the upper left 3 midlines were off, mainly because she had this functional shift because of the crossbite of the upper left 3. And she came in, she wanted to get treatment to line up her lower teeth, but then she also felt that her bite wasn't very comfortable. So, we said, yes, we can definitely help you out. She wanted something very aesthetic, but she didn't feel, that she would be the best patient for aligners. And so we settled on lingual braces. And so this is her at the day of bonding of her lingual braces. And again, here's her first scan. And this is something that, again, I routinely do in the office to make sure they know how to use it, but also so I can get a baseline of how the teeth started. And then you can really get a good appreciation for how severe that maxillary constriction is and how, off that crossbite is, and just get like I said, a good appreciation for the malocclusion. She actually did pretty good on her first scan, and we get a mixed bag. A ton of patients actually do good with the scans on the first go round, and so she did good with that. And now that we have the scan that we did in office, we now have a baseline for. And so we're chatting back and forth, and everything's good. I'm looking at her scans. And then she, sends me this message where it says, "Good evening. I know this is random and a bit weird probably, but it looks like my teeth in front are moving the opposite direction. This may be perfectly normal in your observation, but I wanted to make sure, LOL." And so I sent her a message back, send a video or a clip or a pic, and I'll take a look and let you know. And so this is the video that she sent over. And one of the things that she was referring to, and I'll show you in the messages coming up, is that, excuse me, her midlines are shifting a little bit, but they're shifting in the correct direction because we're getting the movement and the correction that we need. So I'm able to look at everything, the upper and the lower. I'm able to look at the bite. There's no picture that I can't really see much information on that I have to try to make a diagnosis of. I have great information to really see what's going on. And the beauty of something like this is you're not ambushed by it. So it's not, the assistant comes over, such and such is saying this, where they're explaining the story totally wrong. And you go over and you don't know what you're walking into, and you kind of have to figure it out on the spot. Well, when they send these videos in, you respond when you want to. So, I've had time to digest the information, look at the previous scans, look back at the chart notes, and really come up with a good explanation for everything before I respond to her. So this is how I reply back. I'm assuming you're referring to the upper front teeth. Yes, they are moving to line up with the front of your lower front teeth. So again, I'm dumbing it down to speak in her language, so that she can understand it. But if you go back, and this is again why I take this initial scan in the office, because I want that scan to be good enough that I can refer back to it. But if you go back and look at your very first scan, the line between your upper and lower front teeth were not lined up appropriately. Now they are closer together. In other words, they're moving how they should be. And she says, okay, yes, my upper 2 front teeth, sorry. Okay, although it's looking like it's going in the opposite direction, it's normal. It's a normal process. looking at the scan now. And she got back and said, okay, I see the difference. Thanks for your guidance. And I said, no problem. So I took a situation where in her mind and in her head, what seemed to be a problem, it seemed to be an issue that it goes unattended or unaddressed, will turn into a bigger problem than it needs to be. But with this, I'm able to communicate to her and talk her off the ledge, so to speak, to really put this fire out before it becomes a big issue. And a lot of times in our office, things are not as big of a deal as the patients think they are. But when you have a front desk telling them, or an assistant telling them, oh yeah, don't worry about it, sometimes they can feel like their concerns are being dismissed. And to hear it directly from me, because we've all been there where somebody's giving the assistant or front desk a hard time, and then the doctor shows up and all of a sudden everything is all good, all those complaints and concerns went out the window and it's fine. And so there sometimes can be a difference hearing the message from the doctor. And you can do this a ton of different ways in terms of who responds to the patients. I typically do it in my office, and so I handle that. But even if you have someone else doing it, it can still look like it's coming from the doctor, which again carries a little more weight. So I was able to diffuse a situation that potentially could have gotten way more out of hand than it could have or should have been. And so this is a scan that I got. So again, I see this for lingual braces, not aligners. I'll see them or have them do a scan every 4 weeks. And so you can see that crossbite on that 3 is working itself out. Her bite is coming together nicely. The midlines are lining up a lot better. The alignment in the lower is getting better. And for those who don't use Embrace, typically what you do is you start with 1 wire, and it does what it needs to do. When you don't see any more activation, you move on to the 2nd wire. And so this is, again, going back to getting the most out of the appointments. There are times where I would see the patients every 8 weeks, and they would come in and we would look at the pictures, and I would look at how they are now, and I saw movement, so I'll see them for another 8 weeks, and they come back and I didn't see any movement. I'm like, okay, great, we're able to move on to the next wire. Well, the thing is, out of that 8 weeks, maybe 2 weeks into that, they got to the point that they were ready for that next wire. But I put them on an 8 week recall, and there's 6 weeks where nothing was essentially happening. So with this situation, I can look at the previous scans, and when I see there's not much movement, I say, okay, you're good to come in. I'll have the front office give you a call to get you in. So she came in, and we upgraded her to the next wire. We did see her one time in between. She did have a crown on that lower right 6 that came off. We put it back on at this appointment. And then at this appointment, I, telling her again, just motivating, hey, listen, we're coming along nicely. We got that crossbite out of the way you're smiling, your bite is coming together so much better. The alignment is good. We're giving you this new wire to keep everything going. So I'm motivating her. She's showing up, and I'm not, just saying, okay, we're going to let this wire work and keep it going. So she's receiving the value of each appointment that that she's seen in the office, but then also appreciates the communication and the dialogue that we can have, throughout her process. So up until this point, I've seen her 3 times, and the next time she comes in will either be done because we just need to let the 2nd wire, work out these little tweaks. If she's not done, we'll get in for an enhancement scan. But again, this is just the efficient treatment that we're able to do without having to see the patients so frequently and so often. All right, so we'll do this last one, and then we'll kind of roll into some of the other advantages, because I don't want to bore everyone with cases. But we have Isabella here. She was a little over 12 years old when we started treatment. And she presented to the office, bilateral class 2 ectopic canines, not much room in the maxillary arch, some mild crowding in the lower, not too shabby. Just that lower right 2 is rotated with the mesial out a little bit. But she presented to the office, and obviously as an orthodontist, I can handle a case like this. But the parents were very keen on wanting to do it with clear aligners. And in my office, I try to be appliance agnostic, and I don't like to hammer one treatment modality with the patients. And what I found is for teens who actually want the aligner, so not teens that are in treatment because mom realized they don't have to come that often, or the hygiene can be a little bit better, so they are really pushing the kid to do it, but the kid wanted braces and colors. that's a disaster waiting to happen. But for the cases where the teens themselves, want the aligners, it usually works out very well. And, obviously communicating with the patient and talking to them through the exam, you kind of look for red flags, and she didn't give me any. She was very mature for her age, and she was on board with it. So I said, what the heck, let's do it. I decided to start with the motion appliance first. I know there's a lot of controversy with this appliance, but some of the negative downsides of it was actually beneficial in this case, because one of the things that one of the side effects is you get extrusion of the canines. And for her, she had these maxillary canines, and I can appreciate, and I welcome some extrusion of those canines. So this is her first scan. We do in-house aligners, like I mentioned earlier. So instead of giving her just an Essex retainer, we actually gave her around the lower aligner, so we can line things up as we're correcting her class 2 bite. And again, this is just good information that I can see. I can see the bite, I can see the upper and lower teeth. I just have a better feel for what's going on in the mouth. And so at this point, we start off with the motion, and we'll do a couple visits. And so again, just me coaching along the way, and just looking at the scans. And at this point, I see that the canines are a lot further extruded than we started. I see the maxillary space between the centrals, and this is big here, the space between the canine and the laterals. So these are all signs that she's doing a great job with her elastics. And we're at a point to where that lower right 2 is lined up. So we're really making some great progress in the case. And at this point, I decided, I think we're in a good spot with the motion appliance. Let's get her back in so we can take it off and get her into upper aligners to finish it off. And so that kind of goes back to how I mentioned earlier about this appointment optimization. And it's about being able to know exactly when to see the patient and not having wasted appointments. And so when I go back to the motion appliance and how I've used it, in the past, I would give the patient, we would start on with the appliance, give them elastics, and then I would see them, at 8 weeks first, just to make sure everything is good. And then I would see them 12 weeks later. And then if we're still not there, I'll see them 8 weeks later. Well, it goes back into that, the process of we're spitballing these intervals of when we think that the patients will be ready. And we go to different lectures, and we look at protocols that other doctors are using, and they make sense, and is great. It's not that they're wrong, but the thing is, everyone's biology is different. So there's no cookie cutter approach in terms of when we need to see the patients and when things will be ready. So for her, I didn't have to see her again until we were done with the motion appliance. And again, this is coming from my own experience. So I'm not, talking down on anybody else who's seeing patients, not as efficiently, but I would see patients and say, okay, we're not ready. And then I would try to look and say, maybe 4 weeks, or should I do 8 weeks? And the truth of the matter is, you just don't know. But to give them the elastics and to see the change and know exactly when they're ready to come in just really improves the efficiency. So in addition to the appointments on demand feature, it's this appointment optimization that is very powerful as well. And so this is how she started. This is the day we inserted the motion appliance and the lower aligners. And this is where she finished, where, slight overcorrection, she's in an edge-to-edge bite now, but we have the spacing that we need. Essentially class 3 molar bite, which is the overcorrection that I look for with the motion appliance. And then we got her in, got the scan a few weeks later, gave her the aligners, and I'm back on, hey, listen, I'm the cheerleader again. I'm just coaching her along. Good job with the scans. Your canines are starting to come down. I'm starting to see a big difference, looking good. I like the space, all these things that, are just telling me, like, listen, we're making great progress. Things are moving like they're supposed to. Let's keep this going, because, it's always this excitement around the start of treatment. And then, you see these changes happening, and then all of a sudden we hit this plateau where we're not seeing these drastic changes anymore. And it's real easy for us, for the patients, I don't want to say get discouraged, but to kind of lose that momentum. And it's important upon us to, incorporate and to fuel them to keep them excited about treatment. But then the other thing is, a lot of things that, the changes that they see that they may be concerned about, I'm just confirming that, hey, listen, that's good. That's what is supposed to happen. That's what we're looking for. So it gets rid of that anxiety that, hey, I don't know about this, or is it supposed to be this way? And so it's kind of a twofold advantage that I see there. So again, this is typically what it looks like. Hey, awesome, your aligner, fits perfectly, perfect, looks good. And that's all, that's it. And I'm just, again, just motivating them, keeping them, excited about the treatment. So this was another huge update that Grin came out with. And so for me, unless I need to say something specific to the patient, I typically give them the thumbs up and tell them that everything looks good. One thing I wish we could get is a like button so that I can just click on it and say like, because everyone's different. I don't like to leave people what I call hanging. So, I'm that one that always has to send the last message back. Not everybody's like that, but I am. So if a patient sends something back, I don't want to just leave it in the ether. I have to do something. I have to say something. So just a quick like to let them know, hey, listen, I got your message. I saw it, but not have to say anything would be awesome. But anyway, I digress. It's these saved templates that are now a part of the Grin platform. And essentially what you can do is go in and some of the most common things that you say routinely, just create templates. And so instead of me typing, hey, looking good, or, keep up the good work, I just do 2 clicks and it's sent off. So if I'm going through, a list of patients, it only takes me a few seconds to really respond to them without having to do a lot of legwork and a lot of labor to do it. So this was absolutely huge. And I was so excited when I saw this update come through, because again, all we're doing is just motivating these patients along the way. I like to look at the scans because I'm the type that I'm always excited about the treatment and what we're doing. You don't have to be as invested in it as I am. That's just a personal preference. But in terms of responding, they just appreciate just a quick message from you. And so to be able to do, again, a few clicks to send that message to them is huge. All right, so this is one of the last scans. She has, I think, maybe 2 aligners left, but you can see her midlines are lined up. We have the spaces closed. The canines are, excuse me, in a really good position. We have a ransom triangle elastic just to sock it in, and her occlusion is good. And so I don't have, much doubt that when she finishes those aligners and comes in to see me, that we're going to be ready to take these buttons off, finish the attachments and polish her up and have her done. So to have this whole, okay, well, we have to wait and see what the patient looks like when she comes in, is behind us. And so having this information allows me to prepare my team so much more efficiently in the morning huddle about, hey, listen, for Isabella, let's go ahead and get everything set up because, I think she's going to be ready to go. And again, it's just the efficiency. So I think at this point we were either 14 or 15 months into treatment, and I've only seen her 5 times. I think it was 6. I left it out. She did have a button to come off that we fixed. That's actually 6, but that appointment was super quick. But if you think about that, 15 months of treatment to only see her 5/6 times, but just look at the appointments that we saw her for. So obviously we had to deliver the motion appliance and deliver the aligners. The next appointment was to remove the motion appliance, so we didn't have to see her anytime in between. Then we scanned her for upper lower aligners. Then the next appointment a week later was to deliver the aligners. Again, we do in-house, so we can turn it around a lot sooner. And a lot of times when I'm using appliances like this, where there's a chance for things to relapse, I like to get them back in a lot sooner, so I don't have to make all these retainers and do all these things to hold things. In the meantime, I can just take everything off, clean up, get the scan, and have the aligners ready to go in a very short time. After that, we did a scan for refinement. And then obviously we had to deliver the refinement aligners. And just with those appointments, we're able to get her from where those canines were high up to a situation where you see at the bottom where we're pretty much home and scot-free. And so again, just the power and the efficiency that Grin allows me to treat is the most powerful reason why it really spoke to me, and why we really started using Grin in our office, because I saw the value that it could provide for us. And again, you think about her parents and her not having to come out of take time out of school that often, not have to take off work, all these little things that are not case sellers, but they're kind of the add-ons that provide value that the patients and the parents really see and really appreciate. So to be able to offer this to the patient is something that's magnificent for them. Okay, so next we're going to transition into patient management and education. And so, like I mentioned earlier, the appointments on demand feature was the main reason that I, started using Grin. And as I started to use Grin, there were all these, off-label. I don't necessarily call it off-label because Grin had their own vision before. But from my perspective, it was the off-label or white label uses of the software, and that's the patient management and education. I kind of hinted on it earlier with Lisa, where I talked about where she started freaking out about her midlines and teeth shifting, and being able to just communicate with her to calm her down and realize like, hey, this is a great thing and things are working out how they're supposed to. And I'm really seeing a lot of value in that with other patients in the office as well. And so some of the things that, being able to remotely monitor our patients is one, we become that cheerleader. And like I mentioned, the majority of my conversations are, hey, looking good. Keep up the good work. Your fit is good. Your teeth are moving along great. Just that motivation is what it's all about. And to be able to provide that to them along the way, instead of when they actually see you in the office, is huge. The other thing is you can inform and educate patients. A lot of times, our team goes over things and not everyone's the same. Some people are really good at explaining information. Some people are in and out in 2 seconds. Sometimes you have patients that, get the proper information, but for whatever reason, none of it was digested well, and they start thinking other things in their head and just get way off track. And so to be able to, prevent that is also special. And then lastly, to put out the sparks, before they become forest fires. And that's huge. And, from a customer service standpoint and just being able to have, satisfied patients, it's really important that you get ahead of these situations before they become something that's way bigger than they need to be. So again, this is the value that being able to remotely monitor them with Grin and educate and manage the patients. So we'll start off with Carla, and here's her first scan. Again, these are our in-house aligners. We added buttons from day one to start class 2 elastics. And again, this is just to make sure that she knows how to do the scans, but then also so I can have a baseline of where her teeth were. And I'm not showing her case, but there's some unique things about her case that you'll see as to why I'm sharing it. So again, nothing special. Just showing the scan and all the information that I can get. I love to take that first scan so I can show them, hey, listen, you see how your aligners were fitting back at your initial scan, and you see how they're looking now. There's a big difference. And that kind of puts the ownership on them when, they start having these tracking issues. And the first thing they want to say is, I do everything like I'm supposed to. I always wear my aligners. And you say, well, listen, I'm looking at your history. First 2 aligners we were good, and then we start to fall off. And better yet, you kind of can catch them before things start to fall off and tell them, hey, listen, maybe stay on those aligners a little bit longer, or back to the previous aligner, or what have you. And so for her, everything is good. I'm just sending her, good job. Everything is great. And the message before, again, this is before the update, I told her, I'd asked her what number she was on. She replied with good morning, number 1. Now, granted, I've seen like 3 scans at this point. And so I said, did you go backwards? The last scan you were on number 3, you should be either on number 4 or number 5. She says, maybe I made a mistake, but I'm still using number 1. I don't know when I can start using the following numbers. I say, okay, I see. You're supposed to change every 10 days to the next aligner. Go ahead and change to the next set that says number 2 today. And in 10 days on November 11th, again, very specific with her to make sure she's picking up what I'm laying down, change to number 3, and then change to number 4 10 days after that. So, I try not to say, hey, listen, you got to do better than this. You should have known that you should not still be on aligner 1. I just use this opportunity to just educate her on what we should do, because the truth of the matter is I don't stand behind my patients, or excuse me, my assistants, to see every hygiene and instructions that they give out. They are trained to all give the same thing. We also have little pamphlets that highlights everything that we talk about, so the information should get there. But again, sometimes it's the information is not that great. Sometimes the information is great, but it's just not received how it's supposed to. So she responds back, clear. Okay. Only that I was not, that was not explained to me at my appointment. Sarcastic smiley face. And I say, again, not to point the blame at her or to cast any, issues with her. Hey, sorry for the confusion and sorry you weren't told this. My apologies. So again, we're taking ownership of it. It's not a back and forth about, well, I'm pretty sure you were told this, but maybe you just heard it wrong. None of that. Just tell her, hey, listen, sorry about that. Because it's all about customer service and I want patients to be happy about the treatment. And then I get a good smiley face now. So I don't get the semicolon, closed parentheses. I actually get the emoji this time. And so I think we're all good. She sends a scan in and I say, great, we made it to aligner 2, LOL. Everything looks good. So at this point, we've hashed out whatever differences we've had with the communication. We're back on track. Everything is good. We're smooth sailing. So I thought. And so we're sending messages back and forth. And I think I asked about rubber bands or something like that. And I said, yes, that's correct. How are you doing with wearing your rubber bands? She says, rubber bands, I still don't use. Are they the little bands that grab each other from above and below? Yes. Why aren't you using them? And she says, because I don't have it. And because maybe they didn't explain to me well, and I didn't understand about the process, when and how I had to use them. I think I should go to an appointment so that someone can explain it to me. And so at this point, I said, yes, I agree with you wholeheartedly. I'll have the office give you a call. Because at this point, we just need to get in front of each other so that we can get on the same page and we can, just really get the information to her. And again, I don't know if the information was bad or she didn't understand it, or, maybe the team member didn't explain it that well. But we put the buttons on, explain what they were. She knew the buttons were there. She knew what rubber bands were. She was handed a packet of them. But at some point there was some, loss in communication. So she comes in, we get everything hashed out. Everything is back on track. The next scan I get is aligners that are fitting well. She's moved on to the next set. We have her rubber bands in. So, we're able to, move the case along. And I prevented a situation where, we give this patient, 12 weeks or 3 or 4 months worth of aligners, only for her to come back and we still are at the same spot that we were at the beginning of treatment. And we've wasted not only our time, but the patient's time as well. So to be able to kind of, find these issues and highlight them early on to kind of get the train back on the track, if you will, is huge, so that we can keep things moving along they're supposed to. Because again, for me, efficiency and being able to finish on time or early are some of the biggest things that I look for in treatment. And so I highlight that because this is a patient, as you can see from the treatment note, it's not Carla. This is another patient that we used to use Invisalign. As you can see, this is from 2018. It says the patient wore aligner 7 through 12 in descending order. So instead of, we gave her the first set of aligners 1 through 6. She wore those perfectly. She showed up to the office. We gave her 7 through 12, but for whatever reason, she thought it was a great idea to start with number 12 and then go to 11, 10, 9, and 8. And so she showed up to the office. We're ready to give her the next set, only to find out she was on aligner 7. We had her fit a couple of aligners. We settled on number 9, and then we worked our way up. But this is a prime example. We changed 10 days. And so, 6 aligners are 10 days. That's 8 weeks worth of treatment that nothing happened, that we, essentially ended up at the exact same spot. And this is not something that happens all the time, but it does. And again, it doesn't matter how good of an explanation you give certain patients. For some reason, certain things just happen the way they happen. And I'm just thankful that I have a way to kind of find these issues and, address them quickly so that we don't lose time and waste both our or the patient's time. So this is just a prime example of a time before we were using Grin, where we just had a complete waste of time with the patients. All right, so next I'm going to transition to Megan, and I have to avoid panic and freak out. And looking at her eyes, when I look at her now, she kind of gives me that, just intense freak out look. But she's super sweet, super chill, and super nice. She came in because she wanted aligners to fix some crowding that she has on the lower, and some other issues that she has going on. Again, not trying to show her case, but this is what I got, and I'll paraphrase some of this. And basically, hey, I know it's late on the East Coast. She's on vacation somewhere. I think she was out skiing or something like that. But I've had a bit of a revelation while on the ski trip, and my upper teeth definitely still need a few sets. Several pictures that I've taken from this trip without my trays in, and I feel like my upper teeth are worse now than when I started my braces journey, even though she's in the aligners. And I've sent some pictures from yesterday, and then also some pictures that I had from before, just for comparison. And I'm also slightly concerned about the discoloration, just all these issues. And I don't know if, she was, sipping some tea at this moment, because again, this was rather late in the day, but she just had this epiphany. And then this is what she sent me, and I'm just kind of scrolling you through. So this is her in the picture with this huge jug of beer, showing me the pictures of her smile before and after, so I can have some comparison. And so again, I was able to look at everything, go back at her clinic notes, look at her pictures, look back at the scans, and check everything out before I responded to her. And essentially what I did was just made this collage for her. And I won't read this whole paragraph, but basically I told her, listen, Megan, you're tripping. Okay, your teeth were super deep. I couldn't see, your lower teeth on the left side. I showed her a picture of her lower crowding as well, of the progress that we made, and just told her, hey, listen, your teeth are so much better than how you were when they started. But then also, we're still in treatment. We're not done. This is not the end. I wouldn't expect this to be the final result, but let me show you the progress that we're making along the way. And then also, I think that this coloration that you're talking about is actually just a little plaque buildup. So we should probably just work on brushing that area a little bit better. So I'm able to educate her about that, but then also just show her, hey, listen, we're making great progress. And now she has the same access that I had to her scans and to her pictures. I don't know if she went back to look at them or not. But to be able to have that history is huge. And in my office, we update pictures a lot, but I can only update the pictures when they're in the office. When they send these scans in, I'm able to just get more information, more data, and I can just again illustrate the progress that we're doing along the way. And she responds with, okay, wonderful to hear. I just misunderstood your last message. Haha, I thought this next set was the last set, blah blah blah. Thank you so much. Sorry for the minor freak out yesterday. So again, I walked her off the ledge, because in her mind, her teeth were way worse than how they started. All these other issues that she didn't see, when brought to her attention, she realized, okay, you know what? You're right. I see it. I understand. And again, this, took it from being a situation where she's freaking out, where she would have showed up in the office, telling the assistant, hey, I'm just not happy with the way things are going. We had, patients on either side of her listening in, and it's just not good for morale. And so to be able to directly communicate with her and, diffuse the situation before it got out of hand, again, it's just one of the advantages that we have when we're able to remotely monitor our patients. Here's another patient, Ashley, that I'm seeing her scan again. She's in aligners as well, and it just allows me to really get ahead of some of these situations before the patients can actually ask me something. So for her, we're still early in treatment. She's very constricted upper and lower, decent amount of crowding in the lower. The canine is blocked out. And one of the things that I noticed was the fit of her aligners on the lower left 3 was not ideal. And so here's a still shot of it. Again, it's not that bad, but when I saw it, I got ahead of it and sent her a message to notify her that, about that. And so, again, it's before the update, which aligner are you on, blah, blah, blah. But then after I pointed out the fit of the canine, she said, I keep seeming to have trouble with the bottom canines, with the chewies, but I'll definitely keep trying. And then I told her, hey, it's okay. It's still within the normal range of fitting. Let's just keep going. And what would usually happen in our office is, one, a patient would call in and I would tell them, okay, just take a picture real quick and send it in. And they would take these horrible pictures because they didn't have the retraction. I didn't know which tooth number I'm supposed to look at. and it was a disaster. The other thing is, which is the worst, case scenario, in which I hate, to happen, and I always tell my team members to avoid this, is to actually get the patient in, because they would get in, I would look in here and I would say, you know what, I see exactly what you're seeing, but all the other teeth are fitting good, so don't worry about it. It's fine. And again, they have taken time out of their day to come in just for me to tell them, just keep wearing the aligners. There's no big deal. And then also sometimes, because at this point I'm being reactive, and they're pointing out an issue or concern to me, and I'm telling them, hey, no big deal, just keep going. Sometimes it can be received as a bit dismissive, and no one wants to feel that way. Everyone wants to feel that their concerns are legitimate and that they're being heard. And so for me to tell her, hey, listen, I see exactly what you're seeing. Just keep using the chewies. It's no big deal. Because the truth of the matter is, she has so many other issues that are going on that the aligners are fitting well enough on that we're just going to keep going. And I'm not going to stop and get a scan for that lower 3. If we start to get worse, maybe so. But if not, we're just going to continue the treatment, and we'll pick up whatever we need to pick up in the next scans. Okay, so I'm gonna take my microphone out for a little bit so you can hear this video. So this is, again, me just looking at the scan, and I noticed a little fit issue. And so one of the beauties of Grin is you have the ability to type a message back to a patient, but sometimes either the message is gonna be super long, or it's going to be confusing trying to explain it. That is better for you to just articulate that verbally to the patient. So you have the ability to do this scan review where you can record yourself looking at the scan, and you can communicate with the patient whatever information you want to get across to them. So I'm going to take my microphone out so you guys can hear the video.
Good morning. Good morning. I hope your day is going well. I just wanted to point out one little thing real quick. So when I look over here on your bottom left, I am starting to see a little gap starting to form between the teeth and the aligners. We're still in good shape, so there's no need to panic or worry about anything, but just make sure, one, that we're wearing it full time, but then two, that we're using those little rubber chewy things to really bite the aligners down to make sure we get them seated. So every time you put them in, use those little rubber colors to bite on to make sure we're really getting these aligners to seat down. But I'm looking at your progress, especially this tooth right here on the bottom is actually starting to move forward a lot. So we're making some good progress, and still in good shape. Just make sure you're using those little rubber chewies to bite the aligners all the way in. All righty, that's all I have, and I hope you enjoy the rest of your day.
So it's just that easy. And so to be able to type that in, would take way more time than it needed to, and it could be so much more confusing. But there's two things that I'm doing in that. The first thing is I'm educating her about, hey, listen, you have to be proactive about the fit of your aligners. If you start to see this gap between your teeth, you can't just, push through and hope things are going to get better. But at the same time, I'm also motivating her. Hey, listen, it's not a big deal. No need to panic. And then I point out something that is moving like it's supposed to. Hey, this lower, tooth here is starting to come forward really well. We're in good shape. Keep up the good work. Because again, I need the morale to be where it needs to be, because ultimately I want a good result. I want to finish treatment on time or early. And the patient, to a certain extent, is responsible for that. So yes, we've done the setup, we've done all these other things, but the patient has to carry it out. And so I need to motivate the patient so that they can help themselves, but also help me at the same time. So again, positive, encouraging, but then also, point out whatever issues that I need to point out to them. And so this is how she responded. Noted. And thank you, Dr. Lockhart. I think I rushed to do my scans before bed, but I'll be sure to be more intentional. Have a great week. This technology is amazing, by the way. And I told her, I agree. And so this is one of those things where it's like, all right, you're right. I got you. No response. Okay, I'll do better. Thank you. And it's just one of those things where it just enhances the communication, because I can catch these things before they really get out of hand. Because something like that, what it was, she was wearing her aligners, but she was not wearing them the amount of time that she needed to, because she recently came in for a scan, and we had to talk about that. And but she did get better after her liner started fitting a lot better. But it takes the onus off of us. And so instead of me seeing her come into the office with the aligners not fitting, and we have to have this huge conversation about, why they're not fitting, what happened, and, have to hear her tell me that she was wearing them all the time, 24 hours out of the day, she never took them out, blah, blah, blah. I'm able to, hey, listen, this is, not the best fit. Make sure we're using the Chewies. And she's like, okay, I hear what you're saying. Granted, I'll do better. So now the responsibility is on them to take control of their treatment, which should be their mindset from the beginning. So again, just another example of being able to manage patients, but then also educate them at the same time. Here's Alondra here. And what we have is she has light force braces on, and we have those custom turbos on the upper centrals. And again, whenever we put something on, we always explain it to the patients. But I'm telling you, when you start treatment, they hear the assistants, but they don't hear anything. They're just feeling around. They're trying to get used to this, and the assistant is talking, and the stuff is just going in one ear and out the other. And again, we do give them written instructions about all the stuff that we talk about, but certain things just doesn't land. And so basically, she sends this picture. Say, hey, so these two blue things are bothering me and making me talk weird and giving me a hard time to eat. Are they supposed to be there? Well, absolutely, they're supposed to be there. And we talked about this when we delivered your case. And obviously, I'm not going to say that. But yes, they are supposed to be there is what I responded back with. And then I went on to say, hey, they're doing a couple of things for us. They're going to help us so that when you bite down, you don't knock your brackets off. But at the same time, they're putting pressure on your lower front teeth to open the bite. Because one of the things she did understand from our consult is that her bite was extremely deep, where she covered all of her lower incisors. And so I took this opportunity again to tell her, yes, they're supposed to be there. So this is a part of the plan. This is normal. That's how it's supposed to be. But then I also educated her on why they're there. So they're not, so she doesn't feel like they're just there just because. No, listen, they're there for a reason, and they're going to help you, get to the end point a lot faster, because one is going to help you not knock brackets off, but then two is going to help work open your bite, which is one of the main reasons you came in to see me. So again, to be able to educate these patients to keep them motivated is super important. And then I finished with some reassurance. Hey, listen, after 3 or 4 days, you won't even know that they're there. You'll talk normal. And then eventually, once we are done with them, we'll remove them. So I have told her that they're supposed to be there. I've explained why they're supposed to be there. But then I've also put her at ease about it. So again, just taking all of these little mini fires, and I don't know that her situation would have gotten out of hand or not, but to be able to prevent it regardless is very powerful. And to really be able to educate your patients is something that you'll really appreciate and see as one of the benefits. Okay, and so the last part, and we'll wrap up with this, and then we'll kind of open it up for some information and then some Q&A. But this is another one of those white label, if you will, uses of Grin, and it's to train your team. And so in this particular case here, this is a guy I went to high school with. Is his wife. I'm from Georgia. They still live in Georgia. I'm treating her remotely out of state. And we have aligners up top and we have braces on the lower. And there's two things that I pointed out. One, if you look at the lower right 5 and see how the mesial half is not engaged at all, the lower right 3 could be still tied as well to really engage that wire, because again, I'm seeing her remotely. So I need this treatment to be as efficient as possible so that when she shows up, we're able to progress through wires and do other things. But when the wire is not fully engaged, we're only going to get so much movement out of that tooth because the wire is not engaged. So I'm able to, in the huddle, just real quick, pop the screenshot up with all the assistants there. Because again, I'm not pointing out one particular assistant, because easily I can go back to the note and see who it was and just address them individually. But this is something that I want to address with everyone so that everyone can receive the message. And a lot of times when we, speak to our team members, especially clinically, it's kind of hard to explain certain things or talk about certain things when you don't have a visual. And fortunately for me, I'm a visual learner, so I see the value in that. So a lot of what I do in terms of educating with my team members is I have to try to have some sort of a visual so they can understand it. So to just go into the Grin app, look at the picture gallery. So again, I don't have to look through the scan and find a good shot, I can just look at the picture gallery, download the picture, pop it up in the huddle, and explain not only what happened, but why it's important and why it's significant that we pay attention to these things. The other thing that I pointed out was the turbos on the lower sixes. Now, these aren't some of the worst turbos that I've seen in my office, but what I like to have are nice, smooth, kind of ovoid turbos that cover the mesiobuccal cusp. And these are kind of like just these circle blobs that are, it'll get the job done. But from a comfort standpoint, when they can bite on a more even surface instead of these little balls, things kind of feel a little more comfortable. So I'm able to put it up. Hey, listen, guys, this is not, how I showed you how I like to have the turbos done. And then I'll usually have another picture of the ideal way. But again, I'm showing them in the huddle right before we go see patients. Listen, this is what we need to do. And I'll on the screen kind of highlight the surface area that I like to cover with the turbo. So again, this is just something that I can just pop up real quick just to educate the team members so that we can all get calibrated, all be on the same page so that we can get the most out of the appointments. And then also, give the patients the best treatment that we can give them. Another thing is, again, we do our own aligners, which means we fabricate them. And I was starting to get scans in, and then I would notice on all of for some reason, just the maxillary second molars, they were trimming at an angle. And so, the first time I saw it was maybe, the scan didn't capture all of the second molar, and thus the model didn't have all of the second molar. So obviously the aligner could not have all of the second molar in it as well. But then when I kept seeing it, I started thinking, okay, there may be something that's going on. So I went back into the lab to look at the models. And in fact, the sevens were ideal. We had all the information that we need. They were, for whatever reason, trimming it in this way. And so again, pull this picture up, show them, hey, listen, a lot of times with the second molars, we're doing movement and we need more wrap of the aligners around these molars so that we can get the movement that we need out of it. And when you guys trim it short like this, it limits the effective tooth movement that we can get on that tooth. So let's make sure we can keep it at the level of the gums like we do the rest of the teeth, so we can make sure we can get the movement that we need out of it. And again, I'm able to provide a visual. So it's not, me saying, hey, you guys aren't trimming these things right, and they don't know what I'm talking about. Or me saying, hey, we're trimming these a little high up on the second molars, and they don't really have an idea of what I'm talking about. So to be able to show them and explain to them exactly what I mean and what I need just allows us to communicate so much easier and so much more efficiently. I have a ton of other little, examples of the patient education and whatnot, but I don't want to sound like a broken record and to get mundane. So I'm going to finish and wrap up with this. I think we're going to have Dom come on for a second just to explain a couple of things for you guys, and then we're going to open it up to the Q&A so we can go over some things and I'll answer whatever questions you guys have. But I want to thank you for taking some time out this evening. I know it's not the easiest thing to do, but I appreciate it. And hopefully you learned something or you took something from the webinar. And again, I don't have a list of talking points that Grin has given me. This is me just showing you, how I'm using the appliance and what I do in my office. I was also a user of Grin before, I started speaking for him. So it wasn't, the other way around. So I just saw the value in it, and it has helped me in my practice immensely. And I just want to share my experience with it. So thank you. And thank you to everyone at Grin for allowing me to present tonight.
Thanks so much, Dr. Lockhart. Appreciate it. Appreciate you sharing your cases, the workflow, the experience. It was very informative. So thank you. Good evening, everyone. I'm going to keep this short. I know we're running a little on time, and I want to absolutely make sure we have enough time for Q&A with Dr. Lockhart, but want to let everyone for attending. Thank you for taking time out of your evening. Hope you found it informative as we have. Just want to go over just high level for any current users on the call. We are offering promotion. If you buy 50 scopes, you get 5 free. And also for any potential new Grin subscribers that are interested, part of what we prefer is that, reach out to one of our sales reps. You can scan the QR code. There will also be another email that's going to come out where you can book directly time into our calendars, or let us know how we can reach out to you, and we'd be happy to discuss about next steps about you coming on board with Grin. So thank you so much. And I'm going to pass it back to Dr. Lockhart for some Q&A. Thank you.
All right. Thanks, Dom. All right. So we'll open it up. And Jillian, I'll let you kind of take it from here in terms of if we have some questions in the chat, or if we're going to unmute everyone and go through the questions. It's up to you.
Absolutely. Well, thank you so much, Dr. Lockhart, for a great presentation this evening. Everybody feel free there. We're going to have the Q&A now. And I did not mute anybody. You guys were a good group tonight. We had no disruptors. So everybody is off mute, and feel free to, if you have any questions, to ask away. And I do have a couple of questions that were sent in prior to the webinar. So we'll let some people take a chance to ask live, but if not, I do have some for you, Dr. Lockhart.
It's always shy at the beginning, and then once the
I know.
the floodgates open.
I have a question. This is Sonia Frilliman. I was wondering if anybody is having their staff be the one to primarily, check the Grin scans that come in and respond, and at what point do they turn it over to the doctor, or how much leeway do you give staff members to respond and make some decisions about things?
Yes, so I'll answer that, but then I know Dr. Gage, he may or may not be on the call tonight. I know Dr. Shulov, he has his way of doing it, so I'll let them expound on that if they will. But you can absolutely delegate this to a team member. In fact, there has been a recent update that will allow different team members to have their own login. So before, it was just one login and then one back and forth communication, which was from the doctor to the patient. Now you can create different users, so to speak, that can chime in and respond to the patients. And I know a lot of people will delegate that to a team member and only come in when they absolutely need to. That is a great way of doing it. I have no qualms with that. Me personally, I just do it myself because, again, I have set times where I'll come in the morning, right after the morning huddle before I get pulled in for a patient, open up Grin, hit my templates, right before lunch, same thing. And then doing it that way, I never have just this backlog that I'd have to catch up with. And it just helps me, stay on track. So that's how I'm using it. So I'll let, some of the other users that they have, some comments about, how they're delegating it to the team and when the doctor gets involved with that.
I'm not sure if Kobe's on here, but I'll take it from my perspective. I too was doing it myself in the beginning because I kind of like to be that involved, and then it got to a point, especially with all of my other extraneous activities, that I needed to give it over, and it's actually been phenomenal. I think it depends on the level of the team member. I know Dr. Gage does have scheduling coordinators and clinical coordinators that answer different things. For me, I think that it's a team member that has had some clinical years behind her, and so this way she can answer a lot of questions. She can have the autonomy to know if a tray is fitting or not fitting, or if an arch wire is engaged or not engaged. As soon as there's any kind of question that is directed to the doctor, then it's very simple. It's a very simple thing for her to just say, hey, doc, can you take this one? And, I've got it on my phone as well, or the mobile version on my phone, so that I can jump in there and answer it as well. So it's pretty simple. And I'll be honest with you, I think right now, the way I have it set up, although Debbie's taking everything for me, I'm still getting pinged on my phone. So when I look at the text that a Grin came in, I can very easily see, is it a scan? Is it a question? And then if it's a question, I can already see the first couple of, the first couple of sentences of the question. So I'll know if it's something I need to jump on, or I can just leave it for Debbie to take care of. So every doctor does it a little bit differently. And that's what I kind of love about this. This is why I love that we had, Dr. Gage giving the webinar last time, and then Dr. Lockhart doing it this time. And each one has a different flavor of how they do things. And in every practice, this is going to take on a little bit of a different flavor.
Good question.
Any other questions?
Jillian, why don't you read one of them that came in for you, and then if anybody else is shy to ask, you can also put it in the chat. That's another easy way.
Absolutely. Well, Dr. Lockhart, I had a couple of people that were not able to join live, but that still had some questions that came in beforehand with registration. Oh, we do have a question from Dr. Igor in the chat here. What is the AI component with Grin? Is the question.
I'll take that one. So for now, we are building out AI on a number of different levels, so to speak. The key that I maintained with my team is that I want the AI to be something true. In other words, I don't want it to be AI for the sake of AI. It's what I call responsible AI, so that if the AI is making a clinical decision, we need to know that that clinical decision is in fact in line with what the doctor is recommending. And so we're blending what we call AI and HI, human intelligence, as well. And as we're doing so right now, the AI that exists in the platform is such that, for example, when Grin pulls out the 5 shots that us orthodontists love seeing, right? The facial, the intraoral shots, frontal, the side shots, and the occlusals, that's actually AI that finds the right image and pulls those out. We're also building AI to take the patient through the scan, so that as the patient is doing the scan, it'll actually continue to direct them to get the ideal positioning. So that should be releasing very soon as well. And then, of course, the AI that everybody's looking for, which is this tray fitting, or are the teeth at this point in treatment where they're supposed to be? We are building that out as well, but we are building it out not just by looking at the deflection of the tray, but actually looking at the teeth and understanding where the teeth are and where they're supposed to be. So it's going to be a little bit more of a robust system, and that should be over the course of the next, I would say, 2 or 3 quarters. Great question, though. All right, sorry, Jillian, we keep on interrupting your question.
No, thank you. Thanks, Dr. Adam, for that explanation. Okay, I've got a couple of questions here. One of this question has been, we get asked all the time, actually, so this is a good one. This practice wants to know, how can Grin benefit all treatment types just other than aligners? This person said, I've seen a lot of doctors using Grin just for clear aligners only versus other fixed appliances. Can you talk to me a little bit more about all treatment types?
Yeah, so I mean, I will be the first to tell you that for me, that's how I started. It's like, listen, I only want to use it for clear aligners. I started to see the benefit, so I moved into my lingual appliances. And then more recently, we've transitioned to fixed appliances. And I don't use Grin on every single patient in the office, but I have started to use it amongst all of the different modalities. And to answer the question directly in terms of, how can you use it with other modalities to, still get some powerful use out of it. And it goes back to some of those things like the, appointment optimization. And the same thing is true for, fixed appliances. If you're leveling an arch, it's the same thing. We've seen them in and the wire still has deflection in it. Let's retie and let the wire cook some more. Well, what if, we're just monitoring them remotely? And, the beautiful thing of it is when you look at the sequential scans, you can see the deflection of the wire. So if that lower, 3 was so much farther down and that, 2 to 2 was gingival, there's gonna be a whole, big deflection in the wire. But as you see the scans and you start to see that wire deflection decrease more and more, and then you see that one scan where it looks almost like the previous scan, okay, let's get you in. And then when they come in, is for wire upgrade. And it goes back to that, getting the most out of the appointments. And only seeing the patients when you want to. So it's not just for clear aligners. And like I said, it took a minute for me to see the value in that. But it's not just for clear aligners. There's values for or value for other fixed appliances as well.
Yeah, I think that question that came into Jillian was actually somebody that couldn't make it tonight and wanted the recording. Had they seen what you had said tonight, it makes it very, very clear. And I'll just say, even from my perspective, I mean, you always have to take everything I say with a grain of salt, right? I'm the CEO of the company, but I went in with every single patient. I didn't in the beginning. I was doing it exactly like you, right? First, it was like, oh, it makes sense for this one, then this one. And what I realized is some of the things that you mentioned tonight, the reality is that there's value for every single patient in the practice to have that ability to communicate with the practice in that way. And for all of us at any given time to be able to communicate with the patient or schedule the patient on demand, you know, whether it's observation, aligner, expansion patients, or any of those. Or I've been using it a lot, you know, where I am, for example, if there's a snow day. If there's a snow day, I don't have to cancel out my whole day and worry that I have to get all of these patients in a week from now. I actually say, just send to every single patient that was supposed to come in that day, send us a Grin scan. And then we'll tell you when we need to schedule. And now we can pepper our schedule over the next 4 to 6 weeks. And, you know, we can look at a scan and say, oh, you don't need to come in. Don't worry about it. We're going to push you out 4 weeks because you're looking great, right? So there's just a ton of other little pieces of value. As long as every patient in the practice has this, you don't have to think, oh, is this a patient on Grin? Can I utilize it for this or that? Versus everybody has this. Everybody has this tool. And, you know, there's value in many other ways.
Agreed.
Cool. All right. Well, if that's it, you know, I want to get right on board saying thank you so much. I have not seen this lecture beforehand. I jumped on board literally 2 minutes before, and I was like really excited to see what you had to say. Again, I love seeing how different doctors are using it differently. So phenomenal job. I love everything you're doing. And oh my God, some of those cases are amazing. I'm not going to lie. I did text John Pham and say, oh my God, you have to see this embrace case that Bryan just did because it looks freaking awesome. So thank you so much, because fantastic webinar and also amazing cases.
Thank you. I appreciate it. And thank you guys as well.